Good evening, everybody. I would like to thank AIOS for giving me this opportunity to present here today. So I would be presenting our study, the single center efficacy and safety experience with intravitreal brolucizumab at our center. Brolucizumab is a humanized single-chain antibody fragment which inhibits all the isoforms of VEGF-A. It is the smallest molecule amongst all the VEGF molecules, anti-VEGF molecules. It has a small molecular weight, high molar doses, and a high drug concentration, which makes it an effective drug. Globally, it is marketed as Beovu, and in India, it is marketed as Pagenex. Hawk and Harrier study and Kite and Crystal study are some of the landmark studies of intravitreal brolucizumab in neovascular AMD and in diabetic macular edema. The clinical trial data is very different from real world scenario, and the efficacy is not the same as the effectiveness. Hence, we felt the need to evaluate the efficacy and safety outcome of brolucizumab at our center. We did the study with an objective to check if brolucizumab should be continued as the preferred anti-VEGF agent for our patients with different retinal and choroidal vascular pathologies. Hence, we evaluated the brolucizumab drug in terms of safety and efficacy across all retinal and choroidal indications. It is a single-center retrospective observational study carried out from October 2020 to 2023. The patients were treated with intravitreal brolucizumab across all retinal and choroidal indications, and the patients were treatment naive as well as previously treated with other anti-VEGF agents. We recorded the demographics such as the gender, age of the patient. The treatment indication was noted. The logMAR visual acuity and CSFT, the change in fluid compartment pre and post treatment were noted. Any adverse events, if any, were noted. We studied the change in the logMAR visual acuity, the change in the CSFT, change in fluid status in different compartments at the end of 4 weeks post-injection, and the adverse event count was recorded. 813 injections given in 405 eyes in 354 patients were studied. The age distribution in our population was between 25 to above 80 years, and the mean age was 60 years, was around 60. The most common indication in our population was CNVM and PCV, followed by diabetic macular edema. It was found that there was a significant increase in the visual acuity post-treatment with brolucizumab at the end of 4 weeks, and there was a significant reduction in the central subfield thickness post-treatment. There was a change or a resolution in the PED, SRF, and IRF volume in all the patients post-treatment at the end of 4 weeks. 3 of the eyes developed intraocular inflammation, of which 1 developed posterior segment inflammation. The patient here presented with vitreous floaters, and there was vitritis as seen in the fundus image, and there was vitreous haze. The patient was taken up for, the patient also underwent fundus fluorescein angiography, which showed a diffuse leakage in the later phases of the angiogram. So we went ahead to, the patient was initially treated with oral steroids, and hence because the patient was not responding, 3 to 4 weeks later we went ahead to do the pars plana vitrectomy and took the diagnostic vitreous biopsy sample, which showed a high cellular content, which was predominantly the small lymphocytes against a proteinaceous background. So this is a fundus picture of the patient 1 month post pars plana vitrectomy, and the visual acuity improved to 6.9. This is the OCT, and this is at the final visit in 2023 October. Inflammation has been reported with various other anti-VEGF agents as well. We conclude by saying that intravitreal brolucizumab is an effective drug in various retinal and choroidal pathologies. The risk of intraocular inflammation is comparable to the other anti-VEGF agents used in clinical practice, and hence it should be continued for different retinal and choroidal pathologies with proper monitoring of the patient symptoms. Thank you.
So the patient who developed intraocular inflammation, what was the profile of that patient? I mean, it was the first injection or a repeat injection?
Yes, it was the first injection.
And what was the gap in between the 2 injections which you gave?
Ma'am?
First injection and the second injection was after how many weeks? 4 weeks?
Minimum
6 weeks?
4 weeks. Minimum
No,
4
minimum,
weeks.
maximum.
4 to 6 weeks. Actually, it was mostly the patients were PNR patients, like as and when required.
So they were already under treatment?
Yes.
Rupali. Rupal.
Apollo.
I'll call the next one. Can we have the next speaker, Dr. Ansi, please?